Hi everybody, I'm Dr. Matthew Martinez, chiropractic physician. I'm here today to talk about the Blu Room and the patients that have had some wonderful experiences in the Blu Room. And I didn't want it to be just about me giving a testimonial about how this has brought some increased healing to patients. I wanted everyone to be able to hear that from the patients themselves and be able to look at whether it was blood work, a CT scan, an X-ray, or some other diagnostic materials. The Blu Room is such an amazing entity in itself that it augments you. And that's what we're finding, that it augments your mind. It augments your frequency of healing. And for instance, with Shawn Parman, he's not an RSE student. He is just somebody who wants to find healing. And what he's found is that continued use of the Blu Room is giving him that space to create that healing inside of him that he has longed for almost 30 years. And I know with the blessings that we have at RSE and the teachings of Ramtha, that the RSE students are falling right into this so quickly. And you'll get to hear from these beautiful people, whether they're non-RSE and RSE as well. And so I want you to be able to hear from them today and take a look at these wonderful miracles. Thank you.
My name is Annie. I live in Yelm, Washington, and I go see Dr. Matt, and I go to the Blu Room, which was one of the biggest blessings that has come my way. Recently, Dr. Matt wanted me to have a blood test, so I did. And so a couple of weeks later, I came to see him for an appointment, and Eric gave me the information of my blood test. So he said it was very, very high in potassium. And he said, ordinarily I'd send you to ER. And I thought, no, I'm not going there. And he said, well, let's do another blood test. So he did one. And then I went to see Dr. Matt, and then I went into the Blu Room. And before, when I went to walk out, you know, Dr. Matt and I talked about the potassium. And I said, you know, I'm changing this. So I went in the Blu Room, and so that's what I did. I worked on that, and I said, my blood test, this next one's going to be perfect. So Eric told me he'd call me that night, and he did. He called me, and he says, you know, your blood test turned out perfect. And I said, I knew it. Good. I'm happy about that. So, you know, if you know what you're doing and you believe in what you're doing, it really does work. Blu Room helps a whole lot.
We had Annie come in one day, and you know, of course she was in for a spinal adjustment, and she was complaining that she wasn't feeling good. She was dizzy, all of these other things, and so we decided that it was pertinent that we ran some blood analysis to make sure we weren't dealing with something that we didn't see at that point. So I allowed my physician's assistant, Eric Rink, to run some blood analysis on her, and we found that her potassium levels were twice the level that they should have been. And Annie, being who she is, and knowing how powerful her mind is, she said, well, Doc, I want to get in the Blu Room, and then I want to have my second test done. And so we went ahead and did that, and you know, what it is her potassium levels were perfect right after that.
This is the first blood test that I had, which came back in high potassium, to the point to where Eric wanted to send me to the ER, but I didn't go. So the second one is this one, and whenever I had the second test done, it came out perfect. So I'm very happy about that, because I changed it when I went to the Blu Room.
One of the most common beautiful side effects or increase in happiness that the Blu Room gives you. You know, for instance, with Sandra, when she first came to me, one of the first things that she said that she dealt with for a long time was clinical depression. She was on medication for it. She was diagnosed by a psychologist with clinical depression. And I can tell you as a doctor, we deal with it probably with 65 to 70% of our patients come in with some type of depressive disorder. And the Blu Room is such a wonderful thing that it's taking that whole depressive psychosis of the mind away. It's given you a chance to clear that with joy and with happiness, and that's something that Sandra has found.
My name is Sandra Crosby. I live in Rainier, Washington. I first came into the Blue Room in July of 2015 because I heard some positive things about it, and I fought severe depression since 1997 when I was full-blown menopause. I have seen several psychologists and psychiatrists and been on multiple medications, went off everything about 4 years ago because I didn't like the side effects. My second visit to the Blue Room was in September. I pretty much felt inside the Blue Room like I was in a twilight. I was floating, extremely peaceful. I didn't realize the effects it had until I came out into the lobby. There were 4 people in the lobby, and it sounded like there were 1,000. The noise was so amplified. I had to put my fingers in my ears to tell the receptionist that I needed to go outside, and not just the outside lobby, but outside, that I was waiting for Dr. Matt's session, and that's where she could find me. I have had absolutely no depression symptoms whatsoever since that experience. I haven't felt as blissful other than when I do disciplines of consciousness and energy or twilight. It's been a wonderful experience. I'm looking forward to my next event. My next Blue Room will be this coming Wednesday. Will be my 4th time I've been in it, and I feel blessed that the technology's been given to us, and Dr. Matt has made it available for us. Thank you.
Richard is an interesting patient. You know, I don't treat cancer particularly in my office, in the fact that I'm treating it directly. I have lots of patients who come in with the symptoms of cancer. And what I normally do for them is I co-treat with their oncologists. And Richard is the same entity. And the interesting thing about Richard is he wanted to do anything he could to get well. I mean, he's tried it all: radiation, chemotherapy, herbal supplements, vitamin therapy, chelation therapy. And as we know, squamous cell carcinoma is one of the most difficult to fight. And if you're fighting your mind on deserving to be healed, you have a more difficult time, no matter who you are, in getting well. And that was one thing Richard kept coming to me and talking about, is not only was his body going through these, but his mind was going through this battle. And I suggested to him months ago that we try the Blue Room. And he said, well, why not? What do I have to lose? And I said, well, I don't think anything. And we started him down this road. Now, he is non-RSE, and he had a little bit of difficulty in the beginning with part of the religious aspect of some portion of this, which I found kind of funny, because I don't think healing has anything to do with any denominations, period. And his first experience in the Blue Room was he was completely relaxed for the first time. And that's something that I know with him, he'd never been able to relax. And as we started to progress through his Blue Room treatments, joy was the next thing that happened to him. And this is a man that I know that probably most of his life, joy was something he didn't even know that he could focus on. And we found that his tumors started to shrink as soon as he started to realize that joy and love and happiness were right for him to experience. And this has now been going on almost 12 years of him fighting this, and he's going to win.
My name is Richard Ahrens. I live in Chehalis, Washington. I've been doing massage therapy and bodywork nutrition for nearly 30 years. In 2008, I was diagnosed with squamous cell carcinoma, and I started working with Dr. Matthew in the Blue Room about 6 months ago. And since that time, I've noticed a lot of improvement in my energy, my state of well-being, my ease of adjustments. I've had a lot of therapy and 2 complete rounds of chemotherapy and 1 full complete round of radiation, which almost killed me. And I just had some more radiation. But I do know really the Blue Room has really helped me withstand the symptoms of the therapy I've been doing, and just helped my whole state of well-being. Really makes me feel good, gives me energy, gives me optimism, makes me motivated to continue. It's been a great blessing for me. These are just copies of my blood work and some of other test results to show how the treatment can helps me with the effects of all the treatment I've had, really helped me recover from everything I've had done.
INGE is such a sweetheart. She has just this personality of love that comes across. And when she first started coming to see me, it was basic maintenance for spinal mobility, and you know, she wanted some help moving past things on her personality level. And watching her go in and out of the Blu Room just a couple times, I mean, you could see the change in her joy, and which is really wonderful to see in somebody who already has this bubbling joy. And I love, you know, you'll be able to see her testimonial that I think that we're going to find somebody that's just going to be a magnet for happiness with her.
Hi, my name is Inge and I live in Yelm. I'm an administrator. The first time I went to the Blu Room was August 10th, and the second time was yesterday, which was October 9th, so just about 2 months. And when I was leaving the Blu Room yesterday, I realized that I got an answer to a question that I had. It wasn't one that I posed while I was intending to pose to get an answer to, but it was something that was on my mind, and I got the answer. And then I remembered that at my first visit, the same thing happened. I was having car trouble driving here, and while I was in the Blu Room, I got the mystery was solved of why I was having trouble with my car. And then when I was driving home last night after my experience, I realized that I felt so much better with this Blu Room experience. I mean, I was just healthier and happier and stronger and had a lot more energy than I did when I came for my first experience. And besides that, I was loaded with energy, and my energy has been low. I can't even tell you for how long. My energy has been really low. And I got home, and usually when I get home from work, and this was a Friday night, I don't have energy to do anything, and I ended up calling my friends, and I was just amazed.
My name is SHAWN, and I have a doctorate in clinical psychology. I did my dissertation on attitudes and beliefs associated with spontaneous recoveries. Spontaneous recoveries is a medical term for what we understand as miracles. And I went in depth in terms of the literature and reviewing the literature and trying to analyze and pull out specific components that were consistent across different belief systems, both Eastern and Western religions, what I would call metaphysics, oftentimes is referred to as New Age. And I found a lot of similarities across these different paradigms, and used those in my clinical practice to great effect. And then, unbeknownst to me, I had a different plan that ended up in sickness and disability for the next 30 years. And during that time, I had a lot of time to contemplate and wonder why those principles were not being manifested in my life. And it wasn't until 2015 that they started to be manifested.
SHAWN has been my longest standing patient that I think I have in my practice, a little over 6 years straight. Most of my patients, they come in for clinical work, and we do the best we can, and they probably come back in for maintenance. But SHAWN has been in what we would call an acute struggle for the past 6 years, and it's been only since about 2011, the end of 2011, the beginning of 2012, that we found out that he is positive for ankylosing spondylitis. And ankylosing spondylitis is a very debilitative condition to where your whole spine fuses. And when your spine fuses, you lose mobility at such a catastrophic level that even raising your arms above your head or walking, putting clothes on, going to the bathroom, things that we normally would take for granted are so completely difficult. And mostly what our treatments were centered around was just keeping some type of mobility. I mean, for him, sometimes breathing was a difficult thing.
My physical problems started way back in 1989 with a herniated disc, and then it progressed to chronic fatigue syndrome and medical disability, and then surgery for cervical stenosis. 50% of my spinal canal had collapsed in on itself or filled in with bone. And then that progressed until 2010, and I received a diagnosis of mast cell disorder, or working diagnosis of mastocytosis. And that essentially is a very rare diagnosis, and you can get a serious allergy reaction from changes in temperature, sneezing, laughing, and this went on for 5 years, and literally any time that I drank or ate something, I would get a serious allergy attack. And then in about 2011 or 12, x-rays started coming back to show that my spine was fusing. And then by 2013 or 14, it was completely fused. And I had worked before my medical retirement as a clinical psychologist, and I understood pretty well about the healing process. And as you can imagine, I was a little bit dumbfounded in the beginning, and by the end I was quite angry about my situation. That I knew that healing was possible, and that healing came from a higher power, but my life was going in the opposite direction. And I didn't quite understand why, and me and God had some pretty serious arguments about that.
We did a decent job of keeping him mobile, keeping him active, and with the advent of the Blu Room, and giving some good discussions with Sean about what it might do for him, we decided that it was a why not? Let's make known this unknown.
This is a story about healing, but if you think it's about healing one's body, you're missing the point. And the point is really about love. And that's what made the difference.
Sean, I can remember his first treatment when he got out of the Blu Room. He said, I need to go home, I need to lay down, I'm dizzy. And that's a very common side effect. And I had Sean call me that evening and let me know how he was, and he said he was great, everything was fine, and so I said, okay. And we let him keep going on a weekly basis. And I noticed that about 5 sessions that he was moving on and off the exam table with such ease that I had to start documenting just that movement for him.
About 2 weeks ago, we're in October now, and I had been meditating in the Blu Room and opening myself up to God's healing love. And about 2 weeks ago, Matt, who I've been seeing for 6 years now, at some points twice a week in order to help how my spine was fusing, so it wouldn't fuse in the most uncomfortable or dysfunctional way possible. About 2 weeks ago, he had me lay down on the exam table, and I'm sitting there with my face looking down at the ground, and I hear this little kid yelping and exclaiming how excited he was about what he was finding in my spine. And he made 3 adjustments that were painless, as typical of 8 to 9 adjustments in which I'm yelling and screaming after each adjustment. And then he ran out of the office, and he said, we have to get x-rays. This healing is happening too fast. And so I went and got x-rays, came back the next week, and he came into the room, and we were weeping with joy over these reports that we found from the x-rays. And I don't think we're done yet.
Now, I didn't want to get my hopes up with much because, you know, Shawn had some other pathological disabilities, diseases that he was dealing with mastocytosis, chronic fatigue, depression, lots of other things.
In 1998, I was diagnosed with chronic fatigue syndrome. And as those in the medical establishment know, that's a very difficult diagnosis to make. And it was, you make it through symptoms. It's a syndrome, it's a cluster of symptoms rather than blood work or x-rays and something that's more definitive. And so I sought out Myra Preston, who's a neuropsychologist, is internationally known. And she pioneered some work using QEEG. And the EEG is your standard brainwave activity, and the Q stands for quantitative. And you use a computer to gather and organize all the information from the brainwave patterns that you get. You may have seen this, you wear a cap with electrodes, and that's what gathers that kind of information. And Myra Preston's work found that people with chronic fatigue syndrome, she found a diagnostic marker. And that diagnostic marker was they had the same brainwave pattern as someone with hepatic encephalopathy. Hepatic encephalopathy means that the liver has failed and the toxins in the body that the liver otherwise would filter out have backed up into the brain. And this will cause different brain abnormalities or cognitive difficulties. And those were quite manifested with me. And I will be flying out this month to confirm with another QEEG with Myra Preston that those symptoms are gone as a result of meditation and using the Blu Room to amplify those meditations and essentially to open myself up to God's healing love.
When you have a patient that has gone through so many different disease processes that you tend to kind of give them a glimmer of hope, but not too much as they're dealing with so much. And so false hope sometimes can be detrimental in a way. Shawn's past that. Shawn is now giving hope. And with Shawn, we've had such a great advanced healing since he started the Blu Room that I've had his rheumatologist call me, I've had the radiologist call me to make sure that we were still looking at the same individual because the scans have changed so much, and we'll show you those also. But this Blu Room is real, and Shawn's healing is real, just like all these other beautiful patients.
And in August, I started meditating and using the Blu Room, and I found that the Blu Room enhanced and amplified my meditations. And at that point in my life, I was able to once again tap in to this higher power of love and hope and joy. And it had been probably almost 30 years since I had felt that again. And at that point, things started changing. And I haven't had an allergy attack. And as you'll see with the results from the x-rays, that some miraculous changes have happened. within my spine. And it was basically three things that I learned, and it was allowing myself. I didn't have to do anything. I was actually blocking myself from the healing, from letting God's love in. And those three things was allowing myself to be open, allowing myself to accept, and allowing myself to believe. And that has been a process that I'm still doing now, working on. And I don't think I've seen the end of this miracle, and I'm looking forward to that.
Joan has been diagnosed with Parkinsonian-type syndromes, Parkinson's disease, and she was even fitted with an electrode device in her chest, which they put wires in through the skull in order to stimulate a portion of the brain to help decrease tremors. Joan has gone through numerous Blu Room treatments, and in the beginning, when she first started it, the tremors were moving at a scale of intensities, and then they would dissipate. And she went through this for about 6 or 7 treatments, and then we found that the tremors started to abate almost completely. And then they would come back, and then they would abate, and then they would come back. This was very difficult for Joan on some portions because she wasn't having a consistency. So she would have her whole joy would be, I don't have tremors today, I'm doing really wonderful, then they would come back. And what we started to notice with Joan was that she was forcing a reaction from the Blu Room. She wasn't letting something be. And we had a quick discussion one day of like, maybe we should just let it do what it's going to do. And so she went in there with no expectations, just joy. That was it, love and joy.
Hello, I'm Joan Pulford, and I've been receiving treatment from Dr. Martinez for 4 months for Parkinson's. And I also developed a tumor in my colon. And I've been given, well, I was given 5 months to live 8 months ago. And because of the treatment in the Blu Room, I've now got the will to live. I'm in less pain. And the tremors are less, you wouldn't know it now, but I have longer periods of time when I don't shake. And I want to thank JC.
She came out of the Blu Room I was waiting for, and she came out and she said, I started to shake intensely when I was in there, but as soon as I stepped out of the Blu Room, my tremors were gone, completely gone. And 90% of the time, she doesn't have any tremors anymore, which, as we all know, docs, as you all know, in Parkinsonian-type syndromes, that doesn't happen. So this is another wonderful miracle of the Blu Room. And we know with Joan that this is her mind allowing healing. And that's something that I think with all of these patients, every single one of them, it is the allowing of that movement from going from one point in a journey and allowing that fruition of healing to come through. And that's called hope. And that's what this Blu Room really gives to everyone. Thank you, JZ. Thank you, Ram.